If you've had an ectopic pregnancy, it can be pretty scary to even just think about trying to get pregnant again. But what if you knew that there are ways to reduce the risk of having an ectopic naturally? In this video, we're going to talk about supplements, homeopathic remedies for scarring, and more to make you feel more confident about trying to conceive again. Hello lovelies, welcome to another one of my videos in which we'll be talking about natural ways to reduce the risk of having an ectopic pregnancy. Whether you've already had an ectopic pregnancy and even may have lost a tube already, or you've been told that you're at risk of having an ectopic, or you just want to prevent one in the first place, this is the video for you. 1 to 2% of pregnancies end in an ectopic. And although this isn't a huge statistic, the consequences are huge because not only do you lose the baby then, an ectopic pregnancy is a huge risk to your health. Last week's video was on the causes of an ectopic pregnancy. So if you haven't seen that video yet, then pause this one, head on over, go watch that and then come back. If you pause me, I'll wait for you. I'm such a nerd. Ectopic pregnancies mean that an embryo is developing outside of the safety of the uterus. And this can also happen in the cervix, in the ovaries, even outside of the uterine wall. But the most common is in fallopian tubes, and that's also what this video will be focused on. When I treat women that have had an ectopic pregnancy in the past or they're at risk of an ectopic pregnancy, I focus on measures that fall into 3 main categories. The first is removing any synthetic hormone imprint on their system. The second is supporting the function of the fallopian tubes. And the third is, of course, clearing out fallopian tubes of mucus or scarring. The first category, removing a synthetic hormone imprint of your hormonal system. As mentioned in the previous video, the use of progesterone-only birth control or fertility drugs can reduce the functionality of your fallopian tubes in being able to move an embryo down. However, it's really great with homeopathy that it's possible to detox an imprint like that. And if you're interested in that, make sure to check out the video on detoxing contraceptives or find the link in the description down below that leads to the detox protocols page on my website. In the previous video, I also mentioned that in the 50s throughout the 70s, women that were at risk of having a miscarriage were prescribed DES, but that unfortunately this affected the reproductive system of their daughters that were born. So if you are a daughter of a woman that used DES, it may have affected your fallopian tubes, but I even think that the granddaughters are still affected. So if on a scan it doesn't show that you have any clear abnormalities in your fallopian tubes or in the form of your fallopian tubes, it may still be worthwhile to detox this DES homeopathically. The second category, as I said, is the support of the function of your fallopian tubes. And we need to remove one thing if you're still doing that, and that is smoking. Stop the smoking. Secondly, if you have had a D&C in the past for a miscarriage or for an ectopic pregnancy, your body has experienced trauma. And one remedy that I love prescribing for trauma, both physical and emotional, is arnica. What I often do with my patients is prescribe them arnica in the potency 200C, have them take it once a day for 5 days, and then another 4 weeks, once a week only. I find that it makes a huge difference to a lot of women in being able to process the grief over a past miscarriage or a past ectopic pregnancy, but that also physically they notice a lot of changes, especially if there is pain that has remained after the D&C or the ectopic pregnancy, for example. Sometimes this remedy needs to be prescribed in a higher potency, but I would not suggest that you do that by yourself, but that you do that under the care of a trained homeopathic practitioner. I've got a couple of great supplement suggestions, of course, as well. The first is vitamin C, which I'm a huge fan of anyway. This antioxidant is anti-inflammatory. This is really helpful if there is an inflammation going on, which is causing mucus, but it also prevents any more scarring if you already know that you have pelvic inflammatory disease or endometriosis. Another great supplement for your fallopian tubes is vitamin E. This is a research supplement to restore your fallopian tube. So we love love to have some of that. Now let's throw in some other lovelies like ginger and turmeric. These again are also both anti-inflammatory, which is really important when we are trying to reduce the mucus in the fallopian tubes, of course. And then last but not least, you're going to want to top up on fatty acids, because that too is anti-inflammatory, but it is also supportive of the tissue and the elasticity of the fallopian tubes. We've also got another really lovely homeopathic remedy. Well, it's more of a tissue salt, and that is calc fluor. And I'm almost dreading to mention this again because I mentioned it in a video before for implantation, and I've gotten 10 zillion questions about this tissue salt, but I can't not mention it because it is so valuable for elasticity of tissues in general, so also for your fallopian tubes. And as I mentioned, it's a great support for implantation. You can take calc fluor 6x on a daily basis. In the past, I've recommended to take it only from ovulation until your period to support implantation, but that was for economical reasons. You can take it throughout your cycle. That's really, really excellent. And if you have any more questions about calc fluor, please help me, and don't ask me in the comments or send me another email. Just check out the frequently asked questions, okay? I will link those in. And then the third category is, of course, clearing the fallopian tubes. And this is a question I get asked a lot. How can I unblock my fallopian tubes naturally? Because they can either be blocked due to endometriosis or mucus or scarring. Sometimes this blockage is visible on an HSG, and if your doctor feels like it can be operated on, they will suggest a surgery, perhaps to remove the scarring. However, sometimes scarring or mucus is so minor that it isn't visible, but we know that it is most likely there. For example, if you've had surgery in the past, chances are that there is scarring. Or if you've had these inflammatory conditions or endometriosis, then chances are that there is scarring as well. First of all, I would recommend that if you have had surgery in the past in your abdomen, or if surgery is performed on your fallopian tubes, that you take that arnica, as I mentioned earlier on in this video. And then secondly, there are 2 homeopathic remedies that I would recommend to address the scarring, and those are thiocyanamine and silica. And the way that I prescribe it to my patients is I have them combined by a pharmacy in the potency 6C, and then I ask my patients to take a 1 tablet of those or 1 pill of those daily for about 3 months. I have seen some really special and amazing results with these remedies. I've seen it on skin tissue, for example, that was scarred, and that is how I am 100% sure that it will also make a difference on the inside. Not only that, I've had cases of women that are known to have scarring in their fallopian tubes, and then they were able to fall pregnant and have a healthy baby. I've got a really cool case written out on my website, so I will link that in for inspiration for you as well. And then what is also really helpful for scarring is fertility massages combined with castor oil packs. And I know I've promised this video a while back already, but I finally got it planned, and now I'm going to combine it with a castor oil pack. So I think that will be a very nice team for you. When it comes to mucus buildup in your fallopian tubes, I think it's really important that you know if you have had an STD or you have one. So it is valuable to get tested for that. And then it is really important that you get treated for it. Another reason for inflammatory conditions in the body are often metal toxicity, is my experience. That also applies to something like pelvic inflammatory disease. Another reason for mucus buildup can be candida, so you want to make sure that you are on top of your candida issues. I will link in the description down below an article on my website on addressing candida. Overall though, when it comes to mucus buildup in the fallopian tubes, I think you would benefit the most from seeing a homeopathic practitioner that takes your case to find out what the reason is for the mucus buildup and to target that specifically. I haven't got any main remedies that I can prescribe to you and say, hey, that will solve that. Apart from, of course, the supplements that I just mentioned that are all anti-inflammatory. And then the same thing applies to endometriosis. Although endometriosis is related to estrogen dominance, and I've got some videos on that on this channel as well, I think you would really benefit from having your case taken by a practitioner that is trained and to address that endometriosis. If your inflammatory condition is related to metal toxicity, again, you can detox homeopathically these metals from your body, and I will make sure to link that down below as well. If you want to learn more about detoxing homeopathically, make sure to click on the video on your screen right now. And in the meantime, see you in the next video. Bye!